Welcome to the only patient advocate podcast you'll ever need. In this podcast, you'll learn how to advocate for yourself and your family, and where to turn when if that becomes overwhelming. Now, here's your host, Joyce Schulz-Killian, registered nurse and owner of At Your Request Patient Advocate, LLC. She is your private patient advocate. Here at your request to communicate, educate, and advocate with and for you.
Hello, everyone. It's Joyce Schulz-Killian. I'm a registered nurse for 27 years and in healthcare since I was 18 years old. I am the owner of At Your Request Patient Advocate, LLC, and I'm here at your request because I am your private patient advocate, helping you navigate healthcare one puzzle piece at a time by educating, advocating, and communicating with and for you. I'm hoping to give you the tools you need to be your own best private advocate. Find me on Facebook at Your Request Patient Advocate, and on Instagram at JSKICURN, and on Twitter at RN Advocate, the number 4 and the letter U. Hit like and subscribe. I'm also going to be on YouTube, and that is what I was supposed to be doing here, was recording. And so let's see if we can do this all at one time. So today we're going to start up where we left off last podcast, which was with the discharge instructions. So this podcast is going to be about discharge and discharge planning and discharge instructions. So most patients, when told that it's time to leave the hospital and be discharged, are ready to go when they want, when they're told that it's time to leave. While clinicians emphasize that recovery continues after they're discharged, most are able to go home, or in some cases, some will go to a nursing home or to an intensive rehab. However, the decision regarding when to discharge a patient can be complex, due in part to ongoing nature of a person's recovery. In a significant proportion of cases, experts say that patients are discharged before they're clinically stable. There's a doctor, Dr. Owen Najayan, I'm probably screwing up her name, Nguyen, an assistant professor of the internal medicine and clinical sciences at UT Southwestern Medical Center in Dallas, states in a Newsweek article that they found that 1 in 5 people were discharged with one or more vital sign instabilities. A vital sign, we had found that people had higher odds of being readmitted or of death within 30 days that correlated with the number of instabilities. She reports, referring to research she led published last year in the Journal of General Internal Medicine. The more instabilities people had when they were discharged, the more likely they were to have some bad outcome after they were discharged home, whether that was needing to come back or unfortunately dying. So again, I'm not trying to scare anybody by these, really just almost, they seem devastating numbers of medical errors and things like that, but I'm just trying to educate you. So we're going to talk about the discharge packet. And before we even get the packet, I want you to think about things. So discharge planning starts at the time of admission. And not that you're thinking of discharge planning at the time of admission, but the facility is already thinking of discharge planning at the time of the admission. So, but when they tell you that it's time for you to go home, I want you to start thinking about these questions. I want you to ask yourself some of these questions before agreeing that it's time to be discharged. Can you get in and out of bed safely and independently? Am I able to go to the bathroom? Am I having trouble urinating or with my bowel movements? Will I be able to self-administer my medications? Am I able to eat and drink and keep food and water down? Do I have any new symptoms or uncontrolled pain? Is there anything I'm afraid of with respect to my health upon leaving the hospital? So these are all critical questions to ask even before you get that discharge packet. If you don't agree that it's time to be discharged, you have a right to appeal that decision. The first step is to talk with your physician, the primary care physician that's coming to see you, and the discharge planner, and express your reservations. let them know that you're just not feeling, your blood pressure is still off, or you're not adjusted to this medication. They tend to try to push people out a lot faster than they should. And that is to the detriment of both the patient and the hospital, because as you'll see later on in my discussion here, the hospital gets punished if people are readmitted. And instead of doing anything about a readmission, like trying to figure out what went wrong, they created observation, but that is a whole nother podcast. So if you don't agree that it's time to be discharged, you have the right to appeal. First, contact your physician, tell him. Usually that will, kind of stop things if you talk to your physician. Discharge planners don't have a lot of control. They're waiting for the physician to make that decision. If that's not enough, you'll need to contact Medicare, Medicaid, or your insurance company. Formal appeals are handled through designated quality improvement organizations, QIO. There are different organizations for the different, for Medicaid. It's one organization. For Medicare, it's Levanta. And they are the ones that will look at the progress and what is happening and then make those decisions. You should know that if a QIO, a quality improvement organization, rules against you, you will be required to pay for the additional hospital care. And I warn people up front, if you're appealing anything, nursing home stays, rehab stays, hospital stays, and it's gone past the physician and you can't, you don't have an answer, it's going to probably be a no. So, and I do warn people that, you will be responsible for those costs, for all the costs that you incurred during that time that the hospital said that you were ready. The hospital must let you know the steps to take the case, to get the case reviewed. They'll give you a paper, a number to call for Medicare or Medicaid, depending. Okay, so now let's see. Now we're going to get to the discharge instructions. Are we to the discharge instructions? Possibly. The discharge needs to include discharge instructions. This is what needs to be in all of the discharge instructions. So it needs to include the physical condition of you or your family member both before and after the hospitalization, details of the type of care that will be needed post-hospitalization, and whether discharge will be to a facility or to home. And you should know that prior to that. If it's to a facility, you've been talking to the discharge planner about where to go. That's a whole nother discussion because, well, it's not a whole nother discussion. It's a good discussion here. So if you've got the 3 overnight stays and you are a Medicare eligible client, then you are eligible for rehab if they feel that you can benefit from it. So say you've had an intense stay in the intensive care unit or on a general telemetry floor and you've been in bed. And you've had a heart condition, say atrial fibrillation, just an irregular heart condition, but it's caused you to be short of breath. Maybe you had a procedure, maybe you had an ablation done. So now you've had your 3 overnight stays and you're eligible to go to a rehab facility. They're going to be working with you from the very beginning if they think that you're going to be in there for 3 days. And there are certain conditions and certain procedures that would warrant you staying in the facility for 3 overnights and then requiring some form of rehab. A stay in the ICU and the intensive care unit is one of them. They say a day in the intensive care unit usually takes a week of rehab to recover. So they're going to be talking to you about different facilities. You need to be afforded the time to look at the facility, call and speak to the facility about what their policies and procedures are, especially during this time of COVID, where visitation restrictions are in place and there could be a quarantine possible. You have a right to do a visit to the facility to see if it's a good fit for your family member. and you're allowed to do all those things, and you should be allowed and afforded the time to do all those things. And the discharge planners are really trying to push you. That is where a patient advocate would come in handy, because we know we have vetted the different rehab facilities around, and we can tell you which ones are performing well at the time and which ones are not performing well. And instead of having to view 6 different facilities, maybe you're only viewing 2, and they're 2 of the best. So details of the type that'll be care, whether you're discharged to be facility or home. So we talked about a facility. It should include information on whether the patient's condition is likely to improve. That's something that it should tell you in those discharge instructions. What activities you might need help with, what activities you might not be able to perform yourself if there are lifting restrictions or things like that. Information on your medications and diet, and what extra equipment might be needed, such as a wheelchair, a commode, oxygen, and who will handle meal preparation, transportation, and chores, and possibly referral to home care services. So depending on what you were in the hospital for is going to dictate what your discharge home looks like. So say it was a minor procedure, maybe you can go home and you don't need a lot of care, but maybe it was a major procedure, and maybe you're going home and you're going to need a lot of care, especially for the first couple days until you get orientated and everything into your home that's needed. So why is a good discharge plan so important? Effective discharge planning can decrease the chances that you or your relative, if that's what we're talking about, is readmitted to the hospital, and can help in recovery, ensure medications are prescribed and given correctly, and adequately prepare you to take over your loved one's care if necessary. They might not be able to care for themselves at home. Not all hospitals are successful in this, although both the American Medical Association, the AMA, and the Joint Commission of Accreditation of Healthcare Organizations, JCO, offer recommendations for discharge planning. There is no universally utilized system in the United States hospitals, which to me is really crazy. They have rules and regulations about what the discharge instructions need to include, but there is no standardized plan to do that, which I think that we should. Then everybody is on the same page, kind of like ACLS and the heart standards of different conditions you have. I think if we're all on the same page, things seem to go better. Additionally, patients are released from hospitals quicker and sicker than in the past, making it even more critical to arrange for good care after release. And sometimes that takes place after you've been discharged. So if you have a loved one or a caregiver that's with you, they can help to pick up the slack. Studies have shown that as many as 40% of patients over 65 have had medical errors after leaving the hospital. 18% of Medicare patients discharged from a hospital are readmitted within 30 days. And again, the hospital, it says this is not good for the patient, it's not good for the hospital, and it's not good for the financing agency, whether it's Medicare, private insurance, or your own funds. On the other hand, research has shown that excellent planning and good follow-up can improve patients' health, reduce readmissions, and decrease healthcare costs. That's what I'm well known for, is decreasing readmission rates. When I was a home health nurse, my patients did not go back into the hospital. I was there as much as I needed. I did a lot of education, and that's really what it was about. It was about knowing what their goals were and the education regarding that. Even simple measures can help you immensely. For example, you should have telephone numbers accessible. This goes back to my emergency packet information. If you haven't listened to that podcast, it's a great one. It should have telephone numbers accessible for 24 hours a day, including weekends, for care information. It should have the follow-up appointments to see the doctor. Should be arranged before you leave the hospital. Again, I stress that over and over again. If the doctor talks to you one day and says, hey, I'm going to want to see you in 2 weeks, say, hey, can we make that appointment now? Because I know that I'm going to have a really hard time calling your office, and they're going to give me a hard time. So can we make that appointment now while you're here? And Possibly the doctor will help you do that by calling his office and putting you through and telling him what he needs. Okay. A follow-up appointment. Since errors with medications are frequent and potentially dangerous, a thorough review of all medications should be an essential part of the discharge planning. Medications need to be reconciled. It's called a medication reconciliation. That is, the pre-hospital medications are compared with the post-discharge list to see that there are no duplications, omissions, or harmful side effects or interactions of any of the medications. And again, when we talk about medications, we're talking about all of your prescribed medications, all of your over-the-counter medications, and all of your supplements. So if you didn't list those, you need to tell them about that. Under the best circumstances, the discharge planner should begin his or her evaluation when the patient is admitted to the hospital. That's the discharge planner. You in no way are going to be able to see or be thinking about, oh my God, what's going to happen when I go home, especially if you're mid-crisis. So, of course, that's on the discharge planner to do that. And trust me, they're getting in touch with your family members or coming in to talk to you. And you can tell them, I'm not ready for this yet, or I don't believe we're to that point, or leave me some information and I can check it out. And again, as soon as you're able, start looking forward to going home and making the arrangements to do that. So these are the questions to ask prior to you going home. Safety. Is my home safe, and is it a good place for me to recover? Are there stairs, steps, or any other mobility challenges inside your home? You need to create a plan for how you're going to deal with those. Will friends or family be there to able to assist you? If not, you can consider hiring a professional caregiver, and those information either an advocate would have for you or caregiving companies might be listed in the back of the discharge instructions. If they're not, ask for several companies. Transportation. How will I get home from the hospital? Plan your transportation home before it's time to leave. Ask for a ride from a family member, a friend, or a caregiver who can drive you, or talk to the hospital staff about arranging a taxi. Taxis usually aren't arranged for discharge planning. Usually from an ER standpoint, they have vouchers if somebody's coming in, but they're not using those vouchers to send you home. Usually you need to have somebody there with you that can review the paperwork and make sure that they understand it if you can't understand it. It's also important to think about how you're going to get to the doctor's appointment and other activities once you do get home. Next thing to think about is food. Do you have the necessary food and other items at home? While you're recovering, doing errands may be especially difficult. If your refrigerator isn't currently stocked, or if the food in there might be expired because you've been in the hospital, ask a friend or a family member if they could bring you what you need to the house before you arrive, or come there with you. Whoever's taking you home can do some shopping for you. There's also other ways to go around that. If you have a meal service, that can help. But of course, if you can't pick up the meal service, and a lot of the different supermarkets are now delivering to your home. But again, if you have restrictions on weight limits, you're not going to be able to bring those things in. Consider your meals for the first week or two after your recovery and plan on who will help you with the shopping and meal preparation for that. Might be good to have somebody there with you for the first couple days. Ask medications. Think about your medications. Do you have all the medication you need? Have there been any changes in medications during your hospitalization? Will you need prescriptions? Be clear on what your medication schedule and dosage is before you head home, and make sure you have what you need. If not, make sure that the prescriptions are called into the pharmacy, or that you have the prescriptions in hand, and ask the hospital to discharge you with all of your medications. Doctor appointments. What is your follow-up care? Again, talk to your doctor about the next steps in your medical care while he's there, while he's in the hospital. What is my care follow-up going to look like, doctor? Ask if and when you need a follow-up appointment and with which doctor. Ask. Be sure to write down important information and ask a loved one to take notes on your behalf. That is where that notebook comes into play that's sitting at that bedside table. Appointments should be made prior to discharge if at all possible. I don't know. I can't stress that enough. Are you eligible for home health care? Are you homebound? And this includes skilled nursing, physical therapy, and any other related medical services you can receive at home. If you've had a surgical procedure done, maybe you have dressings that need to be changed. They'll talk to you about if you have the ability to have home health at your house or not. Discuss with your hospital team whether you're eligible for home health care, and if you are, if it can be reimbursed through Medicare. Most of the time, if you're leaving the hospital and they're ordering home health for you, it is covered by Medicare. A doctor must make the referral, so be sure to ask them to refer you while you are still in the hospital. Can you go to a facility to rehab instead of at home? That would be a question to be asked a lot sooner than the day you're being discharged. Equipment. Do you need any medical equipment at home? Will you need a commode, a shower chair, or a walker? If so, discuss your needs with the hospital and ask them to arrange for you to leave with any necessary medical equipment. Usually if you're in the hospital and you're having physical therapy come and you need a walker or something like that, they're bringing that to you. They're measuring you for that and bringing that to you prior to your leaving the facility, but sometimes not. Daily routines. What changes or adjustments will you need to make? Make sure you're clear on post-hospitalization instructions, such as medication changes, dietary restrictions, or activities you should avoid. In addition, take note of any activities you need to add to your daily routines, such as exercises, physical therapy, other post-hospitalization care. Household chores. Will you need help with cooking, cleaning, and laundry? I know I would. Even if they don't say it, I would ask for help with my cooking, cleaning, and laundry. Managing a household after a hospitalization can be especially difficult, especially if you live alone. Bringing in a temporary home care can take the stress off you. Seniors at home caregivers can help with meal preparation, personal care, housekeeping, and transportation also. And you can do it. Usually it's a minimum of 4 hours a week, and most of them can accommodate that. You can have them come on one day if you want, or you can have them spread over a couple days. Maybe have Monday, Wednesday, Friday care. Care management. Will you need assistant managing your care? I think everybody needs assistants managing their care. I tell people you wouldn't go into court without a lawyer by your side. You shouldn't be managing your health care without somebody with some knowledge of health care next to you holding your hand through this endeavor also. A hospitalization can be disorienting, and it is common to require some help managing all of your care needs while you get back on your feet. A professional care manager can take the stress off of you and your loved ones by helping you plan and get to doctor's appointments, helping you navigate insurance and healthcare decisions, and communicating with your family and Medicare team. That's me. So all those things are reviewed before you even look at the discharge packet. We're 22 minutes into this conversation and we haven't even opened up the discharge packet of paper yet. So now on to the discharge paper and questions to ask. And here's some more historical information for you. According to a New England Journal of Medicine study, nearly 1/5 of Medicare patients discharged from a hospital, about 2.6 million seniors a year, develop an acute medical problem within the first 30 days that will necessitate another hospitalization, called post-hospital syndrome. These problems affect patients of all ages and commonly include heart failure, pneumonia, bronchitis, and emphysema, infection, gastrointestinal conditions, mental illness, metabolic disorders, and trauma. The best way to guard against post-hospital syndrome is to get a full briefing before you leave the hospital. Unfortunately, some patients aren't given discharge instructions, a recipe for medical disaster. Insist upon them. Insist they are printed, and insist that they review them with you prior to leaving. If they don't, here are the questions you must ask. Has my diagnosis changed? You went in, say, to have your gallbladder out. Is there a special diet you need to follow? You had a tumor or growth removed or a procedure done, and there was a hypothesis of what that would look like. Now that it's out, what was it? What was your theory correct? If they thought you had a cancer, did you really have a cancer? Is it metastasized? Is it further along than they thought? Are you waiting for pathology reports? Is it going to take time to get those reports? Who is going to call you with those reports? I have a patient right now still waiting for the results of a barium enema that was done over 2 weeks ago. He's called the physician's office several times and still has not gotten the results of his barium enema, which now is after Cologuard, colonoscopy, and now barium enema. That is unacceptable. What was the ultimate treatment? What did the doctors do while they were operating on you? Was it a partial or full organ removal? Were there any surprises or complications? This is if you had a surgery. Be sure to ask for a copy of your surgical report. I'd ask for copies of reports of all of the documents. The minute you're leaving, I would go downstairs and ask for a copy of your medical records. You just don't know that when you'll need them. Every surgery has one. Be sure to ask for a surgical report. Every surgery has one, and you may need it for a myriad of reasons, not least of which will be that it will become an important part of your medical history. What should I expect during my recovery? Find out how to navigate the days and weeks ahead. Ask what are the symptoms I need to watch for? What's urgent to attend to? What's something I can alert you to at our next visit? For example, if you have a fever, let your physician know immediately because that could mean a potential infection. But what about a rash? What about shortness of breath? What about different kinds of pain? Ask what level of pain you should expect. We did a disservice to everybody by creating pain as the fifth vital sign. There is some expectation of pain with every procedure that is happening to you. There is nothing that is, can be deemed pain-free. We can try, we can attempt, but just know that working through that pain is something that shows your progress. Is there a different sort of sensation, location, duration, and what would that be? And that would be of a concern. So if you have a pain on your left side, but you were having a pain on your right side, is that something you should be concerned about? If you're feeling a sharp burning in your abdomen, it's important to know whether that's a normal effect of your surgery or your hospitalization, or if it's something that requires you to call your physician during business hours, or if this is a 911 kind of let's go kind of problem. What sort of equipment will I need? We talked a little bit about this before. The transition from the hospital to home requires logistical organization, which is why it's so many patients end up feeling unprepared. Just ask, what do we need at home? You may need a wheelchair for a few days. There's a lot of lending closets out by me in Crystal Lake. We have the Senior Care Volunteer Network, SCVS, Senior Care Volunteer Network, SCVN, and they have a lending closet. I know this because I cleaned their equipment for a while, their medical equipment. I steam cleaned it when it was returned. So you might just need something for a short amount of time, or you might need something for a longer amount of time. If you've had a hip replacement, you might need a raised toilet seat. Because you're not able to sit that low. Are there stairs leading to your home or apartment? Are you going to need help with that? Is there a way for you to get up to them? What activities should you avoid, and what do you need to do? Even something as mundane as a bunion surgery, you might have to spend the first couple days in bed with your foot elevated. If you've had abdominal surgery, there might be restrictions about lifting and bending. This is the time when you're most vulnerable to re-injuries and falls, so you need to ask these questions. What are the limitations on my activities? When can I drive? That's a huge one. You're not driving yourself home because you can't. When is it safe for me to carry a bag of groceries? Conversely, what are your obligatory activities? Maybe it's icing the site for 20 minutes 6 times a day. Maybe it's using large rubber bands every night and morning to restore full range of motion. Find out. Maybe it's a set of therapy coming 3 times a week for a couple weeks, and they're going to leave you with instructions. Are there diet? And trust me, if home health is coming in, plan for your first week to be really busy, because not only is a nurse going to come in and admit you, but physical therapy, occupational therapy will come in and evaluate you also, and it's just going to be a busy week. Are there any dietary restrictions I need to follow? Ask, are there special foods you should buy on the way home? Are there salt, sugar, or alcohol limitations that you must heed? What will happen if you get it wrong? What is going to be the consequences of that? How do I properly care for wounds and incision sites? Find out how often bandages need to be changed. Also, if there are colors or odors, of what kind to be concerned about. How do I properly care for my wounds and incision sites? Find out how often bandages need to be changed, or other colors or odors to be concerned about. What kind of bandages do you need? Can you shower? Can you go in the sun? How do I reach medical personnel? Because complications don't happen on a schedule. You need to know how to get in touch with them 24/7 for immediate help if something happens. Is there an on-call service that answers? Are you going to be able to get through to them? This question is essential. Get a phone number and a name to ask for. When's my next appointment, and when should I come back to see you or my attending physician? What should I bring with me? Very important questions. What's my medication schedule? Again, medication reconciliation. I'm going to say it over and over again. This is so important. One of the most important pieces of information you receive at discharge. If you need to take medications, what are they? Get both generic and brand names. Every medication has two names. Acetaminophen is Tylenol. Ibuprofen is Advil. What are the dosages? What is the timing? How long do I take them for? Get your medication schedule in writing so it can be charted on a sheet of paper with you or with someone else making a check mark every time you swallow a pill. When you're in post-hospital fog and time is of essence, this will become essential. It is only after all these questions are answered and you feel comfortable about having all you need and the care required at home is it time to get in that wheelchair and head out the hospital doors, hopefully not to return. So that is my spiel on discharge planning. Earlier the better to start. Be active in all of the participation of your discharge planning. Keep that notebook handy. Ask lots of questions. Pin your doctors down while you're in the hospital about when you should follow up with them and how those appointments should be made, and try to get them to help you make those appointments while you're in the hospital. Make sure that your medication is reconciled. Are these the same medications I was on prior to being on the hospital? What are the new medications? Why am I taking them? What is the consequences? What will the side effects be? All of these are important things. So I hope you enjoyed this podcast on discharge planning. Again, thank you again for listening. On that note, I would like you all to thank you all for listening. And if you like what you hear, please hit like and subscribe and tell your friends. I would like to thank everyone who has helped me take the plunge into this podcast and with all my dreams I've had in the past 8 years. And that would be Gunnar Collins of Collins Backflow Specialist, who has helped me immensely in this whole process. Remember, I am your private patient advocate. I'm here at your request to help you navigate the healthcare system one puzzle piece at a time by educating, advocating, and communicating with and for you. I'm here at your request because I am your private patient advocate. Find me on Facebook at Your Request Patient Advocate, and on YouTube at Your Request Patient Advocate, on Instagram at JSKICURN, and on Twitter at RN Advocate, the number 4 and the letter U. Hit like and subscribe and tell a friend. Have a great day, everyone.